on the list? Syphilis. Okay. Now, syphilis, you got basically 4 phases of this one. 4 doggone phases, all right? Now, primary syphilis, you basically have a chancre. Now, the chancre in syphilis is basically a soft lesion. It's a soft lesion. That lesion is basically filled with the bacteria. I'll tell you in a minute. But it doesn't hurt. So it's a soft lesion, and it's painless, but it's infective, though. Infective. Now, these chancres end up at the site of infection. So sometimes in females, it may be on the cervix, which means you don't even see it. Well, it doesn't hurt. Makes sense? In other words, you can have primary syphilis and not even know it because you missed that guy. Okay? You missed it altogether. You don't know you got it because it doesn't hurt. Well, if you don't get treated during primary syphilis, you end up on secondary syphilis, which means you hadn't gotten treated in the first place. It advanced into the bloodstream, okay? So secondary syphilis, that bacterium, I'll tell you in a minute, got into the bloodstream, and it basically causes a red rash all over your body, okay? Let me back up a bit. This chancre lasts about a couple of weeks. This red rash can last for months. Months. And these rashes, they're also infected because they will also have the bacterium inside of the rash itself. So both stages, primary and secondary, are both infective stages. Can last for months. Now, you don't get treated here, well, you go into latent syphilis. Now, this is the dormant stage. It's dormant. So you don't even know you're sick at this point. But you still have some of that bacteria inside of you. So latent means it's dormant, it's not doing anything. And if you don't get treated by this part, and latent lasts for decades. It can last for decades. At that point, if you don't get treated, you end up in tertiary syphilis, which is real bad. Now, tertiary syphilis, this is not really directly caused by the bacterium. It's caused by the immune system's response to the bacterium. That's what's happening here. So you can basically have dementia, you can go blind, you can have heart problems, I mean, all kinds of things going on. Systemic problems.
What is it attacking? Is it attacking the neural cells, or?
It's attacking all kinds of cells. So literally, it's really a hyperimmune response to the bacterial antigens. So in other words, you can have your antibodies attacking other cells in your body.
Yeah.
And wherever they attack,
yeah,
that's affecting your heart, eyes. So it's really a hyperimmune response. And at that point, it's hard to diagnose. Yeah, it's bad stuff. All right. Now, here, I don't have the picture of the primary chancre, but if you get to this stage, this is secondary, that's the rash.
How do you not know
Over your
Don't
body.
be touching on me.
And it's infected. And it's even on the palm of your hands and the soles of your feet. It's everywhere. And every little lesion is filled with the bacterium. And I'll give you the name on the next slide. Every little red lesion has the bacterium growing inside of it. Inside of it.
They tells you they have acne.
I'm not sure if this is here, you get a red rash, and here
This is not
how do you
gonorrhea.
not know?
This is
Syphilis, I'm sorry.
I'm just
You need
saying,
to break it open. It being a little lesion.
So
You
if
have to
you're
break it
like
open.
scratching it in their throat,
you gotta be like retarded to not get that. You know what? If I saw that,
Okay, real quick, hit it.
I wouldn't be like,
Straight.
I'm in
Okay.
latent here.
Okay, that's secondary, right? And by that point, you should know something's not right.
Right.
So how you go beyond that stage with it lasts for months. And usually people will get treated.
For chicken pox.
Okay?
If you get it treated, does that go away?
Yeah, it goes away. You gotta get treated. Now let's say
How long will it
for
take?
whatever
6
reason,
months?
this person did not get on some antibiotics.
Why?
They go to the dormant stage, which lasts for decades. And then they end up with tertiary syphilis. Now again, in tertiary syphilis, it attacks the whole body. It's basically your antibodies attacking your own body at this point. You end up with a gamma.
Is that the nose, by the way?
That's his nose.
Oh.
Used to be in
That's his
It's
nose.
really pretty.
Now these gammas are basically painful lesions that can end up on the outside of your skin, like this poor guy's nose.
Oh my
That's
God.
a very late stage of syphilis. In other words, he ignored that. You got to go here before you get to that.
Total disregard.
What if it's
Total
barn?
dumbass. Yeah, I think.
Now here is your causative agent, okay? Treponema pallidum. Okay, so Treponema pallidum is the causative agent of syphilis. Again, lives only in humans. Only in humans. The actual virulence factors in terms of how does it do all that crazy stuff is hard to find out because Treponema pallidum only lives in humans. We can't even grow it in culture. You can grow it in armadillos or rabbits, but you can't grow it in a petri dish. You can't do it, which means it's hard to study. So we don't know how it makes you sick. We don't know. All right? We know, okay, you get it from sexual contact. Now, a mother can actually pass syphilis to her child. The unborn child, that's congenital syphilis. That's really bad. This is now passing syphilis in the womb. It crosses the placenta.
That's before it's born.
Before it's birth, before it's born, before the birth canal, before that even. So it's still in utero. It's really bad. It can lead, for example, to mental retardation. It can lead to malformed organs or even death. That's really bad. All right. Now, most people don't even get to tertiary syphilis, right? Because if you get to secondary, you got that rash, you know something ain't right. Something's not right. So most people don't get that far, where you got dementia, little other problems. So again, worldwide, blah, 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 blah. Diagnosed, right? Primary, secondary, easy, right? Now, primary, you start off with that little chancre, depending on, it may be on the penis or it might be on the cervix, but you have that one little lesion. That's the first sign. But if you get past that, secondary, you got a rash, so that's easy to look at. Now, again, tertiary syphilis is hard to diagnose because just because you have dementia, it could be from something else, right? So it's hard to diagnose at that stage. You like old school. I like that too. Nice music. Now, you gotta get treated, okay? You gotta get on some penicillin to get rid of syphilis. That's easy put. And again, you know how to prevent it. Okay. Now, again, okay, it's been on the decline, okay? Well, looks like we're gonna have a little bit of increase nowadays. Now, these people here, these young people, I don't know what's going on. It's going up a little bit.
That's World War II. It peaked in World War II. The GIs went in Europe. I remember that. Out was swine that was so high. The GIs.
Well, that's when you look at it.
Crazy, right?
My
And
clothes
here is
don't
the
know
U.S.
if
map, and again, more popular. I don't know what's going on in the South, but
It's just hotter.
it is just hotter.
They open minds. They all open minds.
It's just too hot down in the Southeast. You have many.
and the east, that's
Southeast.
the whole east.
Okay. Next one is chlamydia. Yeah.
What,
So
would that make it smarter
chlamydia
if you
is
move to
the
the
most
west?
common bacterial, okay? It's the most common bacterial STD, okay? It is probably the number one in terms of underdiagnosed, okay? And underreported. So many women, for example, have chlamydia, don't even know they got it. So it's the number one underreported and underdiagnosed because they don't even know they got it, okay? Okie dokie. Why? Because women are usually asymptomatic. They don't even know. So again, that could lead to PID. So in other words, any STD in ladies, they don't get checked out early, it can advance to PID, which leads to sterility and ectopic pregnancies. All right. Now, in guys, they know when they have it. So again, painful urination and they got pus. They know something ain't right.
Is there anything guys don't know they have?
I don't think so. I don't think so.
It's
Guys
more
know
sensitive, I
it.
think.
Guys know, and they know something's not right. Okay. Now, in guys, for example, especially,
Maybe they didn't know they had rashes on
chlamydia, if it goes too long, for example, if you don't get it treated early on, you get the painful urination of pus. If you don't get that treated early on, for whatever reason, right, let it go too long, you can end up with lymphogranuloma iridium. Basically, you end up with a genital lesion. And that lesion ends up being a bubo in the groin.
What's the view?
Was it you? Oh, I don't want to see it. Just tell me.
You're going to see it.
Oh,
You're going to see it. So a bubo is basically the lymph node that is swollen real big and it's painful. So it's an overly swollen lymph node. That's a bubo. And I think it's coming up. No, it's coming up in like 2 slides. So if you don't want to see it, cover your eyes. Okay.
Excuse me.
Now, the causative agent of chlamydia, okay, is chlamydia
Trachomatis.
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 Mantis is up.
Now, here's the deal. Chlamydia is an intracellular parasite, so it lives inside of your cells. Okay, it lives inside of. Someone doesn't want to see It lives inside of your cells, okay? It has two parts of its developmental cycle in your cells, okay? In your cells, it has an elementary body stage, or EB for short. So EB is the elementary body stage. That's the infective form of it. Now, the EB stage of it, it can live outside of your cell. And that's why it's infective. It can make someone else sick. Now, the reproductive form of chlamydia is called reticulate bodies, or RB for short. Now, RB, okay, these guys are not infective because they cannot live outside of your cell. So far, so good? All right. Now, there is your bubo. So it's in the groin area, and that's basically a lymph node that is swollen, and it's
Something is wrong with this whole picture.
So that's a bubo. But that's, if you miss the whole pain for urination and pus stage, that's like late stage chlamydia. It doesn't start off like that.
Does this shrink the penis as well or something?
That I don't know.
That's a question.
That I don't know.
Who would ask us, like,
I don't know. All I know is that's a late stage of a chlamydia
It don't look
infection.
right.
It don't look right. Doesn't look right.
sleep?
Okay, doke.
You already got in trouble.
I'm glad y'all are mature crowd today. Okay.
Yeah.
Boy. So here's the cell. Here's one of your cells, for example. And real quick, actually, this is a phagocell in your cell. It's showing you either the EB guys or the RB guys. Only difference, EB guys are infective. They can get out of that vesicle and infect other cells. The RB guys are the reproductive form. RB guys give rise to EB guys. And EB guys make other people sick. RB guys can't make you sick because they got to stay in your cell. They can't live without your cell. But EB guys can live without your cell. And that is what makes that bubo, for example. EB guys. Okay. Don't worry about the whole life cycle. Don't worry about that. Okay. Now, how does it get in? Again, it gets in through scrapes or cut. That's why I was mentioning about the guys being circumcised or uncircumcised, right? If it's uncircumcised, the tip of the penis is harder to, let's like to get little cuts like that than let chlamydia in. All right? Now, chlamydia can affect the conjunctival cells in the eye. It's called blindness in newborns. And in fact, chlamydia infections are the #1 case of blindness worldwide. Period. That's non-traumatic. All right? And it can also affect lining up the mucous membranes. Okay. Now, and teenagers, for example, if they get chlamydia, especially for those females, again, they're at a higher risk of cervical cancer because their cervical line is just more immature versus a mature woman. All right? Again, it's the most common reportable STD in the U.S., but really, it's also the #1 underreported one because many women have it, they don't know. So sometimes when you go to the doctor, ladies, sometimes they do a screen for chlamydia, even if you don't have symptoms. Because you may have it, you don't even know. So they may even screen for chlamydia. Okay. So they basically detect it by PCR analysis, basically look at the DNA in your cells. And again, get on some drugs, be abstinent, or one partner only, right? Okay. Chancroid. Chancroid. Okay? Okay. It's not common in the U.S. Not at all. It's more common overseas, but if someone has it in the U.S., again, they're overseas, someone had some fun, they came back and brought it back with them. All right? Now, the major sign is soft chancre. Now, here's the deal. The first sign of syphilis, right, you also had a chancre, but it was hard and it was painless. Now in chancroid, you have a soft chancre, but it's painful. That's the main difference, right? Main difference. Soft chancres and they're painful. Okay. Now, they can also cause pain for urination in women if these chancres are near the urethra opening. So if they're close to the urethra opening, it can cause pain for urination only because the urine passes over that soft lesion and it just causes you pain. That's all. Okay. Now, who's the bad guy here? Haemophilus ducreyi. So Haemophilus ducreyi causes this chancroid. Now it produces toxins that kills the epithelial cells, and that is what leads to those lesions that are soft. Again, now it's not common in the U.S., but in the U.S., if you do have it, most likely you went overseas and had way too much. Way too much. Same deal, right? Get on some drugs and basically don't have fun overseas, basically. All right. Now, there it is.
Oh, God.
There is.
Oh,
Okay.
damn. That's so funny. It's painful.
It is painful.
Oh.
That is the shaker. And Shacroid. It's soft and it's painful compared to its syphilis. Okay, they're harder and they're painless. Okay? That's Shacroid.
That's why I'm getting nurse or doctor. I hope you get
Now, they were all bacterial STDs. Let's get into viral STDs. Like genital herpes. Genital
I'll show you a
herpes.
doctor.
Okey-doke. Now, the signs are going to be small blisters on or around the genitals or near the rectum. Okey-doke. Now, here's the bad guy. Now, you already know, you should know this. There are two types of herpesviruses, right? You got type 1 and type 2. Now, type 2 causes genital herpes, genital warts. Not warts, genital herpes. Type 1 causes cold sores. Got it? Okey-doke. Now, the bad thing about herpes, right, is that it becomes latent in your nerve cells. So pretty much if you have herpes, you have it for life. Literally. There is no cure for it. There is no cure. And once you've been exposed to it, you have it forever. Why? Because the herpes virus gets into your nerve cells and it kind of hangs out there. And it comes out every once in a while, causes another outbreak. But once you get it, that's it. And there is no cure. Brooke?
So cold sores are herpes, right?
Yep, sure is.
So,
Got it forever too.
so you'll just constantly get those for the rest of your life?
Sure will. For the rest of your life.
Oh,
For the rest of your life. So if you have cold sores, that's herpes simplex 1. Acts the same way as this guy, except it comes out around your mouth and not the other way. And you also have it for the rest of your life. Hit it?
How do you get the cold sores? I remember my first one was at 5. And at 5 years old, it's not like you're having any.
Right. So you get it from somebody else. So someone in your family had it. And for example, if they have lesions, and it doesn't have to be on the mouth, they can have lesions on their fingers. Literally, they can. And I'll show you a picture of it. And they may touch you, or they may give you a kiss. Right? They may kiss you. And if they had a cold sore, and sometimes you may not have a cold sore, because you can spread the herpesvirus without having a breakout. You can. So someone had it in your family. They could probably give you a kiss or touch you around the area, right back here.
Where do you get it from drinking? Like straws or
Really?
put in your mouth if it's a recent?
If it's a recent infection, I don't think you can. You probably can get it from straws, but it's really from someone touching you who has it themselves. It doesn't last on fomites, for example. It's not like you touch a straw, you got it from somebody else. Like direct contact. That's how you get it, direct contact from someone else. And that person may not have been having an outbreak, but they are still infected. They are still infected. There's a question over here.
I was going to ask if it's like, can also be genetic,
Nope.
or is it just from contact?
You get it from somebody else. Somebody in your family had it and they gave it to you too. And they probably didn't know they were doing that. Okie dokie. Now, the herpes virus, okay, it kills epithelial cells at the site of infection, and blisters may form at other sites far away from where you're exposed to it. Okay, so you can be exposed in one area and you end up with blisters somewhere else in your body. Why? I'll show you in a minute. The herpes virus, it basically hangs out in your nerves and it travels along your nerves and goes somewhere else. Okay. Okie dokie. And babies can also be infected as they travel through the birth canal. So if the mom knows they have herpes, they got to get on acyclovir probably about a month before their due date to make sure they don't have an outbreak while they're having their baby. Silver nitrate is for gonorrhea. Gonorrhea. Prevents blindness. Okay, okie dokie. Now you don't have to know this for the test, but I just put in yellow places where herpes hangs out. It is not doing anything, it's just there, chilling. There, literally. Now, for example, you can trigger the virus if you're stressed out, if you're sick, if you're menstruating, if you're exposed to sunlight, or even mechanical irritation, like during sex, for example. That can trigger the virus. And at that point, it wakes up, and it travels along your nerves, and it goes, for example, down here, or it can travel there, or it can even come up here. Because type 2 is indeed the genital version, but type 2 can also cause cold sores. So in other words, it can travel up the nerves and end up right there. Okay. Look. It can also end up around your eye. So again, that person probably didn't get the initial herpes at the eye, right? Probably ended up through the genitals. But the herpesvirus kind of traveled up the nerves, ended up right there, okay? Now this right here is called a Whitlow. It's very popular among people like you, potential healthcare workers. Okay? That's what it is, right? Basically, for example, this person probably had a small cut in their finger, and they were probably exposed to some patient who had herpes. And they basically have herpes on their finger. So it's commonly seen in healthcare workers. So basically wear gloves, people wear gloves. Now, if you have genital herpes, you basically quadruple your risk of getting HIV. Why? Because whenever you have lesions, right, those lesions are easy access points for HIV to get into your bloodstream. Anything with lesions, it's easy to get HIV. How do you treat it? Well, first, look at the lesions, but that's not enough. You normally scrape the lesion, and then you test it to make sure it's actually herpes 1 or herpes 2. Get on acyclovir. Now, acyclovir can either lessen the symptoms or decrease the duration of the outbreak, or it can repress the outbreak altogether if you take it like every day of your life. You can do that if you want. If you want to suppress future outbreaks, get on acyclovir.
For 1 and 2?
Is acyclovir expensive?
I know for 2, I would say for 1 as well. I don't see why it wouldn't work for 1, but I know for 2, get on acyclovir. It kind of suppresses outbreaks. I'm not sure for 1, but I don't see why it wouldn't work.
I know it's $300 for.
It's expensive, yeah. It's expensive stuff.
You got 2, you'll pay.
You pay for it, I'm telling you, you pay for it. Okay. You know the deal, right? Blah, blah, blah. So here's the deal. I just told you. A person can have herpes, and they don't have to have an outbreak, but they can still spread it to their partner. Absolutely. And then that partner has it, and they don't even know they're exposed to it, because just because you're exposed to herpes, you're not going to get blisters that same day, makes sense? You have the virus at that point, you have it. And some day later in your life, you end up with herpes. You're thinking, where did I get this from? You don't even know. You don't know. Because you're exposed to it at some point, and you get your outbreak sometime down the road, and you don't even know who you got it from. But here's the deal. If you have it, it's forever, the rest of your life. Okay, genital warts, okay, also called papillomas. Now, warts end up on your genitalia and surrounding areas. You can have large growths that look like cauliflower growth. And if you have large warts looking like cauliflowers, okay, that's called Condylomata acuminata. Basically, large cauliflower growth of warts on your genitalia. Now, your pathogen is HPV, so the human papillomavirus, probably heard of it, okay? And HPVs, they're also considered oncoviruses. Now, onco, so O-N-C-O, literally means cancer. And since HPV can cause cancer, it's considered an oncovirus. Okie dokie. Now, here's, it's okay. Here's an example of a Condylomata acuminata. This is basically genital warts, but they're so large, they look like cauliflower. Now, of course, they are painful, and more than that, they are distressing. You can imagine if you have that. That is quite distressing. And they're painful. And these warts, for example, these kind of warts are considered precancerous too, so they can be very scary as well. They are considered precancerous warts.
It's not pretty, it is.
Okay. Now, in terms of pathogenesis, it can invade the skin or become intercourse during sex, and it's the most common. It is the most common STD in this country. Wow. HPV is the most common. Scary stuff.
Okay.
Now, of course, it's real easy to diagnose, right? You see those warts, something's not right. It's not right.
Can you pass it even when you don't have warts?
You do actually. So what happens is when you have HPV, HPV causes cancer because its genome integrates into your genome, which means you have it forever. So in other words, its DNA goes into your DNA, and at that point you can't get rid of it. So it's a done deal. You have it forever. And that's why it causes cancer, long-term causes cancer.
The wine, but
The shots that most women get against this, is it
wine.
against trying to prevent
Yeah, after find the time machine.
Oh. Because if you get HPV, you get the warts first. You get cancer later on. Okay, so yes, there are 2 vaccines available against certain HPV strains associated with cervical cancer. One of them is Gardasil, which both girls and boys can get. But here's the deal. You got to get these vaccines before you're exposed to sex. Makes sense? Because if you're already having sex, there's no point. You've probably already been exposed to HPV at that point. So that's why, even if parents don't like it, not children, but basically teenagers, and hopefully they haven't started yet, but teenagers are the ones who need to be getting, both boys and girls. Boys and girls get Gardasil when they're teenagers to prevent HPV and also cancer down the line. Last one, and you get this one early today. Trichomoniasis.
Wow.
So trichomoniasis, or basically trick for short. Okay. This is a protozoan STD, right? So the last couple guys that were viral, they're all viruses. This guy's a protozoan that can cause havoc in females, for example. Now in females, if they have it vaginal discharge and vaginal irritation, but here's the key, foul smelling, but it's a yellow-green discharge. Again, yellow-green, not good, foul smelling, also not good. Now in males,
There we go. There we go.
in males, typically asymptomatic.
One.
One of them. Asymptomatic. Golly. Now, the condom agent is Trichomonas vaginalis. All right, that's condom agent. And I don't have any nasty pictures for this one. But
We
Thank
can
you.
imagine what that is.
you don't want to see that
I don't
one.
want to see
But
this.
again, sexual intercourse. But it's the most curable STD in women. So it's the most treatable, most curable. But also, like many other STDs, it also increases the woman's risk of getting HIV. Now again, how does the woman get Trichomonas vaginalis? Well, they get it from their sexual partner, but here's the deal. The conditions have to be right for it to grow. Now this guy likes to grow at pH between 5 and 6. So if the pH in the vagina between 5 and 6 is going to grow, it's going to do well. Which means, probably right, lactobacillus wasn't there in the first place, correct? All right, because again, lactobacillus keeps it what? 4 to 4.5, pretty acidic. These guys like it around 5 to 6, and that's where they kind of grow and do their bad stuff. Okay. Now, you can actually try to look for these guys in the vaginal discharge, okay? This is Trichomonas, looks like little leaves, they're flat. They have about 5 flagella, okay? That's what you look for. So you look for these guys, again, treated with some drugs, but again, just do all those things, right? Condoms, monogamy, abstinence. That's how you avoid getting that. Okie dokie, so we're done. I told you to get out here early today. So your take-home message, monogamy, right? Condoms, abstinence. Have a good day. Next Tuesday is your test. All this stuff. No bad pictures on the test, though. You won't see any warts or cankers.
You have it in your wallet.
I'll save that.
What is our
Oh yeah, definitely.
Quiz up tonight. Have a good day. You guys